A very good afternoon to everyone. On the occasion of the 37th National Eye Donation Fortnight, celebrated between 25th August and 8th September, we at M. Joshi Eye Institute, Hubli, welcome you all to this iTalk, where we will be enlightening about the process and the details of eye donation. I am Dr. Rajashree M. I am a consultant in Cornea, Phaco and Refractive Surgery Department. And with us is Dr. Aniket Shastri, sir, Senior Consultant in the Department of Cornea, Phaco and Refractive Surgery. Welcome to the iTalk, sir.
Thank you. Hello, everybody.
So I think let's, first and foremost of all, I would like, sir, to tell us what is the purpose of eye donation.
Yes, good morning. One thing we should all know before going to why we are talking so much about eye donation is to understand first as to in what conditions do we require eyes. Eye donation here, just like how is it shown in any movie, doesn't mean that we are taking the whole eye and putting it into someone else's body. Okay. Eye donation here, we are trying to deal with the corneal blindness as such. That is any kind of blindness that is because of the cornea. What is cornea? Cornea as such is only the front part, that is a transparent part, this black thing which we see is what we call as cornea. Okay, so once anything happens to this cornea and it becomes white, it loses its transparency, and light is not in a position to enter inside the eye so that we are able to appreciate or see the world, then what happens is to treat such conditions where the cornea becomes white, then it has to be treated only with another cornea. And this other cornea which we talk about is replacement. We take this and put a clear cornea that is transparent. Okay, now that cornea is not available anywhere. It cannot be manufactured. It's not available in any market. It's not available in any shop. No company can manufacture it. So the only way we can get it is by eye donation. People who donate their eyes after death. So in such cases, we collect those eyes, we take the cornea and that cornea is by surgery replaced in a patient. That is the purpose why we say that we need eye donation, so that such patients can be benefited.
Thank you, sir. So that, in a summary, tells us what is the purpose for donating the eyes. There is the most common question that is asked, sir, and that is, who all are eligible to donate the eyes?
In one word, everyone. Everyone can donate eyes. There is absolutely no, not much problems or much conditions where you cannot be donating eyes. Everyone is age, there is no bar. From a newborn or a small kid to someone as old as 100, we say that 1 to 100, 1 year to 100 years of age, anyone can donate the eyes. Male, female, absolutely no restriction. In all religions, in fact, endorse eye donation. There's no religion that says that don't donate the eyes. We have all religious leaders who have come forward and actually pledged their eyes and told that we should promote eye donation. Okay, there are some conditions. People are, especially people say that I am wearing glasses. If I donate, what will happen to that person who is, whom you give the eyes? So people wearing glasses also can donate the eyes. We want this front part of the cornea, front part of the eye, the cornea, or in Kannada it is called as Karigudde. Okay, so that part has to be clear. If that is clear, then any condition in the eye, be a person wearing glasses or a person who has undergone cataract surgery, he has got an artificial lens inside the eye, or a person who has got any kind of retina surgeries, or people who are blind because of other conditions, not corneal condition, but other conditions, say a retina problem, say a glaucoma problem, okay, or any other condition in which the cornea is clear. Then, if cornea is clear, then you can donate eyes. People with hypertension can donate eyes, diabetes, cardiac disease, kidney function, kidney abnormalities. Okay, so almost very few conditions, very few conditions where we may reject an eye donation call, and that is very less. So invariably, to put it in a single word, everyone can donate eyes.
This is one of the most common myths that is believed in eye donation, that once the eyes are taken, that there will be some sort of disfigurement of the face. Would you please?
That fear is always there among relatives. That fear is always there. That if you give the eyes, then there will be some disfigurement, the face shape changes, and all those things. And that is absolutely false. There is no truth in that. In fact, the the process of this eye donation, where the eye bank moderator or person comes there and collects the eye, is hardly around 10 to 12 minutes, say a maximum of 15 minutes, both the eyes included. And after that, once you look at the eye, you cannot make out that you are donated. There is absolutely no disfigurement, there is no change in the face. No chance of any kind of bleedings or any kind of swelling and all those things. So without that fear, without that, in case that fear or that myth is there among the people, I think that should be out today only with this talk, that there will be no disfigurement post eye donation.
So exactly what should everybody do, sir? Like once the time of death has been announced, then what is the procedure that the family or the relatives are supposed to follow before they donate the eyes?
One thing I want to reiterate is eye donation is after death. Okay. No one is going to take your eyes or force you for donation when you're alive. The eye donation is always post death. Right. And first and foremost is you need to call the nearest eye bank. Okay. Even if you don't have the number of the nearest eye bank, there will be a toll-free number, or there will be some common numbers by which you can just call them Okay, and it connects to the nearest eye bank, or if you have the eye bank number with you or the nearest eye hospital's number with you also, you can contact them. Okay, they can arrange for an eye bank, and usually, I mean, the eye bank services are free and it is 24/7. So you can even call it night 12, 1, 2, morning, afternoon, midnight. You can call anytime. The personnel will come to your place. You need not actually come to the hospital or the eye bank. That is one more fear that you need to carry. I mean, this thing come to the hospital and donate. Nothing like that. The person themselves will come to your place. They'll come to your place, and during that time, there are some things which can be done. Okay, you can just keep a small pillow sort of a thing below the neck, so that the head is slightly elevated. Okay, switch off the fan, because that will cause dryness. We want the eye to be as good as possible, as normal as possible. So switch off the fans, close the eyes. You have to just close the eyelids and take a clean cloth, dip it in a water. Okay, you can just take the damp cloth and keep it on the eyes till the time the eye bank personnel arrive. Usually the eye bank personnel is available 24/7, and depending on the distance. Okay, if we are in Hubli, we usually take around 15 to 20 minutes or half an hour depending on the location. Someone is out of station, then of course it will take depending on the travel time. But till that time, you can do all these things and wait for the person to arrive.
Is there any time limits after the time of death?
Yeah,
For
I mean,
donating the eyes?
you do have to call as early as possible. Okay, you do have to call us as early as possible. Ideally, 6 hours is the best time. Within 6 hours, if you call us, of course, we can come and then collect the eyes. That is the ideal time. The eye will also be healthy. The eye will also be healthy so that it can be used on another patient. One. Second thing, even if it is more than 6 hours, sometimes what happens, the situation is such that, I mean, the people, the relatives, the closest relatives and friends, they are in grief. Then after 4 or 5 hours, someone comes and explains them the procedure. Then they agree, okay, we'll donate the eyes. Even then also, be it 24 hours, or even we have collected eyes after 36 hours also sometimes, when the people have called late and it takes time for us to go to a different place. So ideally 6 hours, but even for 24 hours or so also, I think an eye donation call can be.
So will they reveal that, you know, whom are we going to put the eyes to, or will the recipient come to know whose eyes they're getting, or is there any choice?
No. There's absolutely, I mean, it's a total secrecy. From whom have we taken the eye, or whom are we putting the eye? There is absolutely no relation to that. We are not going to disclose to the patient as to whose eyes we are using. Neither are we telling the people who have donated, the relatives of who have donated the eyes, as to on whom are we using the eyes. So that is kind of a secrecy. So that is not revealed to anyone.
Yes, sir. And what kind of a confirmation is given to the people who donate their eyes?
We at our eye bank as such, we do give them a letter of appreciation, thanking them for the contribution that they have done to the society, and that letter along with the name is being given to the nearest relative, just to thanking them that they have been a part of such a great gesture.
Okay, sir. Thank you, sir. I think this is one thing that we need to highlight, that is pledging. Like, what do we mean by pledging, and how can we do it?
Pledging sort of a thing is a kind of a promise that we make when we are alive. So now I pledge my eyes. I make a promise that after my death, I will be donating my eyes. Okay, so that is what is called pledge, and pledge can be done at the nearest eye bank. Okay, sometimes at our institute, you can come to our institute and pledge. Write your name, give your address, phone number, and we will give you your appreciation that you have pledged, and we'll give you a small card that will have the number of the eye bank. so that in case of an unfortunate event, your relatives or friends can call us. Okay, that is one thing. So you can do it on online also. On our website, at M.D Ophthalmology website, we have an online pledge form also where you can definitely pledge in case you cannot come all the way to our hospital. Okay, you can just pledge and we will send across the pledge cards. There are two things. Two different things in this aspect is pledge versus eye donation. Okay, once you have pledged, means I have pledged that I will donate my eyes, but I don't know what will happen after my death. Okay, it's not a compulsion, it's not a law sort of a thing that I will be donating my eyes. It is not a compulsion. After my death, if my relatives say that no, we don't want to donate, and that is the end of it. There is no force from any of the eye banks or any of the doctors that you have to do it because you have pledged. It is just a kind of a last wish of probably the person who's expired. Okay. So one thing to keep in mind is you have to tell your relatives that yes, this is my wish that my eyes be donated. So please, in case of any untoward incident after my death, please call up this eye bank. This is the number, and tell them that I wish to donate my eyes and please give my eyes. Okay. The other way around is in case you have not pledged. In case you have not pledged, but still the relatives wish to donate, it is possible. So pledge as such is not a compulsion or a law. It's kind of a wish, that it's kind of a promise that okay, I promise that after my death, I would wish to donate my eyes. But at the same time, the relatives have to be told, the closest friends and relatives have to be told about your wish, that this is what you want to do. And in some cases, the relatives, after the death, even though the person has not pledged, then also they can call the eye bank and use that we relatives here want you that you can please, we are willing for an eye donation.
Sir, once the person donates the eyes, how many people are going to benefit from this?
I think this is something which has become, which everyone knows now. I mean, we should be very grateful to Dr. Puneet Rajkumar. Actually, that so that post his eye donation, the awareness that he has created and he has touched upon is even higher probably when he was even alive. There are so many people who are now coming forward to pledge their eyes. They want to donate their eyes, and we all came to know that his eyes, the two eyes, were used in 4 different patients. Okay, so 4 different patients actually got their eyesight because of one person donating. Okay, earlier, probably 10 years before, the procedures or the scientific advances were such that a person, we take both the eyes and we used to use one eye per person. So 2 people used to benefit. Okay, so now the technology is so advanced that we can do surgeries at such a microscopic or a layered level, different layers, that one person with his eye donation can actually give sight to 4 different people.
So with this point being highlighted that when one person donates the eyes, 4 people are going to benefit from this. I'd like you to tell us all, sir, about the burden of blindness in India. Thank you, sir.
And the total blind, if we take, it is more than 1.5 crores. Okay, this kind of blindness involves everything. I mean, all kinds. People are born with blindness. People have developed any kind of illness later, be it related to the retina, related to the nerve. All these things are something includes around 1 to 1.5 crores plus. Okay, and in India as such, the corneal blindness, for which we are so much bothered about or talking about today in case of eye donation. So those are around 30 lakhs. The population is around 30 lakhs people who are corneally blind, and the saddest part of this is 50% are children. When I talk about children, I'm talking about people who are at least 15 years and less. Okay, and they are only in the range of around 15 lakhs in India who are awaiting corneal transplant. So that is a huge sorry state. And the thing is, we are requesting people to donate the eyes post-death. Okay, it's not even something you're supposed to do when you're alive, it's post-death. And with the death rate in India being somewhere around 80 lakh plus, 80 lakh plus, which is I mean, you can imagine how many eye donations can occur or how many people can benefit. One person donating 2 eyes being useful for 4 people at least. So hardly the eye donation that occurs are peanuts. It's somewhere in the range of 40 to 60,000 only. Only once during pre-corona, it was somewhere in 65,000 people had donated the eyes. Then, of course, in corona, so many protocols, we hardly had around 20,000 people donating the eyes. And now the protocols are slightly relaxed, and still now the eye donation is only around 45,000. I sometimes say during my eye donation talks also that 80 lakh people having a death rate, even if 10% people donate, 1 in 10, even if 1 in 10 donate, I think we will just wipe out the corneal blindness in no time, in India especially.
I'd like everybody to contribute towards this noble cause of eye donation and donate their eyes and be the reason for someone else to see the light in the world. With this, we come to the end of our iTalk. Donate eyes and give sight. Thank you, Dr. Aniket Shastri sir, for joining us for this
I just
iTalk.
need to add this that when it comes to eye donation, only the doctor here speaking that please donate the eyes, politician just speaking out or a media people having a cutout will not help. The main part is the society. That is why the eye donation is such a big thing, because we are dependent on a third person here. I have a patient sitting next to me. I am a doctor here in the clinic, but we can't do anything. I can't do anything to that person until the society itself comes forward and starts taking this eye donation seriously. And in fact, it should be made a tradition in the families. There are traditions in different countries where it has become a tradition. Like once there is a death, eye donation is compulsion. Just like any other rituals, they also donate the eyes. So that thing has to enter our system. That thing has to enter into our society. That we have to make this eye donation a tradition in our family. It should be a part of the rituals post death. That is when probably we'll be able to solve most of the major problems of this corneal blindness.
Thank you, sir.
Thank you.